Welcome to another edition of the Falmouth Cares Business Roundtable. I'm your host, Troy Clarkson, and as always, we're happy to be here with our panel of experts, our tech expert, Gary Vacon, Bill Zammer, owner of the Flying Bridge, and the president of the Falmouth Chamber of Commerce, Michael Kasperian. We are very grateful this week, this opening day for phase 2 of our economy, to be joined by two linchpins to that economy, the general manager of the Crest Beach Resort, Guinn, and of course our newly minted Senator, Sue Moran. We're very, very pleased to have you both here on the show, and thank you very much for joining us. Let's start off, as we now do every week, and ask Gary to share some thoughts and some observations, some statistics, and some meaningful data on how things have progressed in the last week. Just a quick disclaimer, during the taping of the show, I will step away for a few minutes for an appointment, but Michael will be glad to take over while I'm gone, and I will be back. But we'll hand it to you, Gary, with thanks for all you continue to do.
Okay, thanks, Troy. Here we go. All right, so this is the usual disclaimer. This data is as of yesterday, June 7th. The usual sources, I've added a few other sources, including the New York Times, CNBC, TSA, Roundtable. I thought some of these things would be interesting today. Once again, I want to emphasize that in terms of sampling how many people have COVID, how many people are infected, in the United States, we've sampled 6.18% of the population. We're sampling about 0.15% a day. Massachusetts, 9.39% of the population. Also, at this point, sampling about the same as the entire country, and it's not a random sample, so statistical inferences are hard to make and have been through this whole process. This chart, I think I may retire after this session today because it's getting awful close to 1. Massachusetts, the growth rate is down to 0.4% a day, and the United States overall about 1% a day. If you think about where we started, where we were compounding COVID cases at 20 and 30% a day back in March, it's a remarkable accomplishment in both the US and particularly Massachusetts, which we'll go into in more detail now. The Massachusetts daily cases continue to trend down, the confirmed cases. This is the confirmed cases. And again, this is the number of tests that were performed per day. So you can make a judgment over whether that makes sense. I mean, when this goes down, when they go down together, you have to be careful about what you infer. But if you blur your eyes, you can see that this number is going down, and we're down, under 500 cases a day in Massachusetts, new cases of confirmed COVID, which is a remarkable accomplishment as well. We always talk about the University of Washington model, which is trying to be predictive. That model has changed again as they've looked at Massachusetts opening up. And you can see this is kind of a measure of mobility over here. And that's going up like this. This is normal mobility, the amount that people would be mixing. This is where we are now. And you can see that drifting up, and that's because we're opening up. And this is kind of the daily infection rate. This is what we measure, this bottom line. This line here is what their projection is. They still think there are about 5 times as many infections in the population, more than what we actually measure with our limited testing. So I want to go on to talk about the phase 2 start today, which starts today. But before I do that, I want to talk about some new reporting from Massachusetts. So if you're looking at the mass.gov COVID site and you look at their data, I want to make sure that when you're looking at the data that we talk a little bit about the nuances. Last week, they started to gather presumptive cases. So in other words, that means not only cases of people who have been tested positive, but it also means that people that it very much appears that it could be COVID, but they haven't actually had the test. So that bumps the number up. So you have to really be careful. And I'll give you an example of how this has been treated by some substantial news sources. This is the Massachusetts curve, and these are some other curves of some other states where they're saying new cases are mostly about the same. But if you look at the Massachusetts data in detail, this spike here was the day that they started measuring and adding all the presumptive cases, and they added them all into one day. So if you looked at that, that brought the average up if you interpreted that way, but you shouldn't, because that's just a new way of measuring. So the truth is we're still in rapidly declining cases in Massachusetts. And, you know, I've seen this data presented this way at CNN, New York Times, and even NPR. So the point is that with any of the data, you got to look at the nuances and make sure that you really understand the data. And some of the data that is being reported nationally isn't exactly correct. So we have to be very careful. And then I also wanted to talk about antibody testing, which they've started to track in Massachusetts. Remember, this is not the swab. This is when you test blood and you figure out what somebody may have encountered COVID in the past. And we've tested about 10% of lower the number of patients that we're testing with the swabs today to try to confirm COVID. But this is also a good test because, you know, there is some presumption that if you do have the antibodies, that maybe you can't for some period of time contract the disease again. And we can also make some assumptions about herd immunity from this data. So this data is really good, and we're starting to gather it in Massachusetts. More of the Massachusetts data that is really positive, the death rate has been going down rapidly and continues to go down rapidly. The hospitalizations has gone down rapidly and continues to go down rapidly. Sorry about that phone. We'll go away in a minute. But that continues to go down rapidly. Moving on to the major health indicators, these are the ones that Governor Baker is using to make decisions about opening up. All 4 of the indicators continuing their downward trend, including positive test rates, patients in the hospital, whether they have to use the surge hospitals, and the death rate. So, I mean, all this kind of led to the opening. We are at week 0, ground zero of phase 2. We've just opened up. And I just wanted to make one other observation as we're looking at this, that 3 weeks ago was Memorial Day. And I think a number of us, you know, just driving around town, looking at the way people were behaving, and that includes me, would have guessed that by now we'd be having some kind of a surge, and we're not. I don't know what to draw as a conclusion from that, but it seems like we're doing very well. Remember, what happens today, what we do today tends to show up in the numbers 3 weeks from now, and that's one of the reasons 3 weeks between phases. But, you know, I just want to admit that I would have thought that maybe we would have seen some sort of an uptick after Memorial Day, and we're not, and that's certainly good news. I want to do a little bit of national data to compare and contrast what's going on in the country to what's happening here. This is the entire country for COVID cases, and you can see that it's not going down at the rate it's going down in Massachusetts. It's down a bit. But remember, this is a composite of multiple states. When you start to break that down, there's a number of states where the cases are still increasing rapidly, and there's states like Massachusetts and New York and New Jersey where it's going down rapidly, and we were the lion's shares of cases for a while. So what you're really seeing is a composite of what's going on around the country, and you can't really treat the country as a uniform entity when you're looking at all this data. But I thought that this was interesting. And then I want to talk a little bit about, which is something we had in some statistics around the impact on business that the closings have had so far. This is some data from the TSA on the amount of air travel. It's just remarkable when you look at this. I'll let you look at this for a second. The restaurant business is the next one. This is data from OpenTable on restaurant bookings, which I think is really also remarkable. And I knew that we'd have a representative from the hotel business as well. This is U.S. hotel occupancy rate, but this is not just resort hotels, so I'd imagine the situation a little different. But I thought this data would be useful for today to get the discussion going. And the reminder is what's in phase 2 is we have retail, restaurants, outside only with restrictions. There's and I know that we'll have further discussion about this, but the restaurants are in a couple of phases during a couple of steps within phase 2, outdoor dining initially and limited indoor dining secondarily. And I put up a couple of the rules that were in the safety standards at the beginning of phase 2, as we were talking about for restaurants, is outdoor only. Lodging, I thought this was really interesting, is kind of no big meetings, no big ballroom organized gatherings. And this one, which I think is really interesting to try to figure out how to manage, is 14 days of isolation is still in the plan for new people coming into Massachusetts. And the retail business also has some standards for, how many people can be in the store at the same time, et cetera. So with that, I will hand this over to the group. Let me stop the share. That's our update for today.
Gary, a couple questions.
Sure.
Barnstable County, I understand how many, was it, maybe Sue might know the answer. I'd heard 8 new cases. Does that
It's
sound
tiny.
right?
It's in the handful, and so I'll let Sue, but it's in the handful of cases, and secondarily, both hospitals are a handful each, a single handful. I think there might be 6 at Cape Cod as of
So
yesterday.
Sue,
I'm sorry, Sue.
in your dual role as senator and local select person, what do you have for numbers?
Oh,
No,
You're muted.
you get on mute, Sue. There you
Those
go.
are the numbers that I was last given at the Barnstable County Reopening Task Force. And additionally, Cape Cod Hospital reported that they are capable of opening testing so that you don't necessarily need a referral from the in-Cape in-house doctor that you did originally. So that's going to help tremendously to open up the Cape, because part of reopening depends very heavily on social distancing and being sure that we follow all the rules so we don't have a relapse and have to start closing things again.
Sure. That's
So
pretty important.
our numbers are favorable at this point.
Correct.
very much so.
Great.
I mean, for a phase 2 reopening, they really are. But, it's interesting, as Gary was saying, today is the first day. And, I know I want to circle back to Bill to talk about the restaurants, but since we have Clark from the Crest here, we'll let our guests go first. And just, Clark, can you comment about, the challenges you faced, not only during closing, but getting ramped up and what your expectation is? I mean, particularly what Gary talked about, people coming from out of state and having to self-quarantine for 14 weeks. I mean, is that realistic? And, how are you coping? And what are your plans over at the Seacrest?
I think that one of the things that we have taken into consideration, and I think Bill mentioned it earlier before we started, is the staffing. How much can we really manage? How much can we really handle properly? And with some of the actual standards in place today with social distances, how do we monitor that? How do we control that? And I think that is the key to us staying in the same groove that we are now, seeing the downward trends and actual results, cases and deaths and things of this sort. We've seen a very positive outpouring of people who are anxious here in the state.
Yeah.
And I think that basically comes a lot from the locals who also help drive the beauty of what we have to offer here on the Cape in regards to, we have the beaches. How many other places in the state have as many public beaches as we have, where you can come and be able to enjoy on the Cape? How many other places have the ability to be able to have the accommodations that we have, where therefore people can come and feel safe and feel comfortable? And I feel very positive in regards to today being the opening day. We started off with a very minimal number, and it's already increased by twofold day by day over the next 4 days. And as we approach into the middle of the month, people are very positive about traveling within the state. And I think a lot of that is driven by our locals, not just by depending on the out of state. The out of state will be slow, but we are extremely positive in regards and feeling positive about what the locals have been able to do for us in bringing about business to the Cape.
Yeah, I can tell you at the chamber, the phone is ringing off the hook, as well as the emails about people who are inquiring and planning to come down. So, we anticipate, somewhat robust season, and that's just great. As far as your staff goes, how are they coping and handling, the extra work, the extra effort that has to be taken? And, what's your message to people who want to come down here, to the extent of, how safe they should feel, that you're doing all you can to ensure that they have a safe experience?
They can feel safe. We've taken every precaution, not only from the state, not only from the American Lodging Association, American Hotel Association, We've approached it with a three-pronged approach in regards to making sure that the cleanliness and the efforts made in the cleanliness are to be adhered to. But at the same time, we are extremely positive in regards to staffing. We have many managers who are capable of doing multiple duties. We have many employees who are capable of doing multiple duties. And a lot of things have changed within the industry. No longer is there a requirement to do the daily housekeeping in the room unless it's requested. We clean the rooms up on departure. We will basically ozone, nuke those rooms prior to a new guest coming in and clean them and deep clean it. We want to protect the staff as well as we protect the individuals who are coming, as far as individuals coming from any place to be able to come to our actual facility. I think we're going to have a very robust season. As we open today, what a beautiful day to open.
Yeah, right.
In the weather, the beach, we have people here. We have people standing in our bar. We have people that want to be here. Our chef is here. We prepared menus for grab and go. We've taken our outdoor pool and converted it into outdoor dining area. We will continuously look for ways to be able to not only do business, but also take care of our staff as well as we take care of the public.
That's wonderful. How about on the restaurant side, Bill? What are your thoughts, as you're gearing up and opening day? What are the same challenges? What's going on at that end?
I'm a lot more pessimistic than Clark is, I'm afraid. I'm not able to open my restaurants to full capacity due to staffing. The Flying Bridge, which has the most outdoor seating, I bet as much as or more than Clark does. I have 200 seats that are available at the Flying Bridge, outdoors, distance spaced, and under the canopy, both under canopy and without under canopy. Yet I'm going to be able to only open Wednesday through Sunday, and I'm going to limit the number of hours because I can only work the people I have so much. This is my winter staff. The other restaurant, the Clancy's, I'm going to open 4 days a week for dinner and just 2 days on the weekend for lunch. I don't have the people. I've tried every way and I could. I've just got off the phone with the congressman a few minutes ago, who was down in Washington, and begged him to see what he can do with the embassy in Jamaica. They're at 25% capacity for whatever reasons, and they're just not processing fast enough. Clark knows he's got the same problem. He's got 100 people due to come in or thereabouts. I had 50. I'll take whatever I can get at this point. But that's the issue. And I think going forward, Clark, I agree with you. We would have a very good season, but people are forgetting. We're not going to do the weddings, and we're not going to do the business functions, and we're not going to do the Chamber of Commerce dinners or the celebratory, how do you say that word? Celebrations, as we would. I just got off the phone with a fellow who begged me. He's from out of state. His daughter died, and he wanted to do a post. He's got people all over the country coming in for this funeral, I guess. I don't know how they're doing it, begging me to have a function for it as a post-funeral thing. I can't do it. It's against the law right now, so I can't help the man out. He was in tears. He wanted to get everyone together as a final thing. So it's a sad situation. I do think that we'll accommodate the people we have the best we can. Again, I'm not going to compromise the quality or service that I can give. It's going to be difficult, but I see a reduction. If I do 30% of what I did last year, I'd be happy. That's the kind of number I'm looking at.
Really, that low? 30% is what you're looking at.
30% of what I did last year. Remember,
Wow.
there are no weddings, there
Sure.
are no functions, there are no business meetings. So all that's gone. And back with the Clarkson with the hotel, my little Red Horse Inn, I'm not sure, I don't have the help to do the rooms and that type of thing. So I'm kind of on a wait and see basis, see what happens. It really is strange. I guess I'm angry in a way. Tell me why maybe Clark, you can help me out with this one, because we both know. Why did you have 6 people at a table instead of 8 people? But where are these rules coming from? Some of them are really silly, but keep going on with this, with rules for us. Why could you serve a bottle of wine now, sell a bottle of wine now where you couldn't before? I mean, think about these things. These are lawmakers Susan, I want you to take note of this. These are lawmakers who sat around making regulations which didn't make sense. And now, of course, they're rescinding the same regulations. And it caused a lot of aggravation for us. And again, we're doing the safety measures, the masks, the gloves, et cetera. But the gloves are just as bad or worse than hands, just so you know. You're better with the person washing their hands afterwards versus using the gloves. Clark, you agree?
I do agree.
Yeah, it's silly. So we're gonna follow through all these regulations, and hopefully we'll accommodate our guests and do the best we can, and just hopefully we get through this to the next phase. Which is, and again, the next phase is interesting. So now 50% of what we can do. What difference does that make? Why 50%? Where did that arbitrary number come from? If I have X number of seats and I can space them out properly, then what do they care about the 50% number? You want to be spaced out. And who's going to enforce all these rules? And so,
Well, that's a good question. That's a good question right there. Whether it comes to social distancing, people with masks, who is going to? And, that's part of, before I want to ask Sue a little bit about in her new role at the other towns, but that's something that the chamber executives, we've been talking about. We meet once a week. And actually, Sue, we've had quite some conversation with my counterpart up in Plymouth now, Amy Naples. So I know that's part of your new territory. And really, I think the message that the chambers are going to be putting out there as well is, if you do come to Falmouth or the town that they're coming to, we need you to follow the rules because, if there's a spike, then the governor could easily roll this back. And that would be devastating economically for the entire community. But are you seeing now that, Sue, I know you're kind of new in the role, but I know you're out and about, and during the campaign, you've talked to a lot of people from the different towns. So pretty much the same everywhere else in your area?
So there are common questions and problems, and I'll tell you what is moving forward about those questions and issues. So the governor, as we all know, has a multidisciplinary committee that's advising on the reopening, and that's headed by Lieutenant Governor, and through the governor, that's how the rules have come out. On the Cape side, the Chambers of Commerce, along with legislators, have put together a task force to take in questions and information. And if you remember, when the first rules came out about what are essential services, and it came out as one set of lists of who's essential, then it was amended the way, and this is the same thing I believe will engender amendments for the current rules. If as industry professionals, you talk about things just the way you have, doesn't make sense to have gloves, and here's why. Doesn't make sense to have 6 or 8 because of the diameters of the table, or however, that sort of feedback, what we're doing on the Cape Task Force, and Senator Sear is leading that effort, we're funneling all these comments directly to the task force and thereby to the governor to really take the industry professional opinions into account and take businesses into account. Because if the businesses all fail, that's going to be a lot harder to come back from. And economic development is one of the committees that I'll be serving on right now. I'm happy to take those comments and forward them along because it's the boots on the ground. It's the experts who do the work that know best, but it is in conjunction with the local boards of health. The local boards of health are getting their marching orders from the governor's office as well.
Yeah. Do you find that, some of the conversation I've heard from is, if different towns are doing things differently, i.e. the beaches, et cetera, or however they handle the reopening, as far as enforcement, et cetera, as like Bill's talking about, that could really drive people from one town to another. So are you finding that people are trying to work, like all of Barnstable County working together, all the representatives, to make sure that the message is pretty clear and consistent throughout the whole Cape?
Well, the Cape Cod Reopening Task Force that Wendy Norcross, the Cape Cod Chamber, is heading, along with Senator Sear, and I participate in twice a week, where we discuss the fact that if you have a homogeneous set of rules for the Cape, it's actually attractive, because it markets, we know what we're doing, we know the rules, and we're working together in unison for safety. We've encouraged all the boards of selectmen to participate, and as best as can be done, to really try to have rules that are in general the same sense. Now, certainly every particular place does have different, physical structure or
Sure.
size of a parking lot, but there's great encouragement if there can be uniformity, that is actually a great thing to market, and it builds consumer confidence.
Clark has left us apparently, but
He'll be back.
he's got a few people there. One of them want to say hello while they're there. Who are they? Introduce yourself, guys. Can you hear it? See us?
Hi, how are you?
I know this young lady. You're the function director.
Hi. Well, I'm in sales. I'm Lauren. Yeah.
Hi,
Hey,
nice to
Lauren.
meet you. Who are the other
Hi, nice
folks?
to meet you. Steve behind us.
Hello
Who's that?
there.
I'm Steve Cross.
Hi,
Hello,
Steve.
Steve.
What do you do there?
I'm the manager of operations.
There you go. You want a job? I'm looking for some people.
Stop now, Bill. Come
No,
on.
no.
Poaching, no poaching.
Clark's not there. He can't see us. Hey,
Right.
Mike, can we talk about, you remember the closing of the downtown street, which I probably was the downtown Main Street was a good idea, I suppose, then not a good idea. But we were talking about your idea of using the ballpark. You want to ask Susan if we can do something with that for outdoor events?
Well, when you talk about outdoor events, you've got.
Wait a minute. Mike, you got to tell me what we're thinking of.
Oh, yeah. So, I mean, it's good. Bill had given a good conversation. We had been talking about maybe doing something. And, to his point, you got the ball field with plenty of parking over at the senior center. And, like in Central Park where they're drawing the circles in white that people can stay in. I mean, a good place to do a concert or a show or other things like that. So
Outdoor movie.
Or outdoor movie. So as time moves on, hopefully something like that could possibly happen. I know the selectmen who have been very flexible and really have listened very intently, I think. And I think that they showed last week that they're willing to take different perspectives and not afraid to change direction if needed, like to your point, Sue, boots on the ground. So I know that they had left the door open when they canceled events through the end of October. That people could apply, and as things changed, the events or event particularly be able to come back. So, Bill, I always think you're brilliant, but I particularly thought that was a pretty smart idea, and that'd be a great way to keep people engaged in an outdoor setting.
Well, Susan, what we're trying to do is encourage people to come to the downtown area. That has been a focal point with the baseball league for years. And if you think about it, if we can socially distance someone from a beach, why can't we do it in that big ballpark? And I think that what you looked at for the benefit of downtown merchants, it would help the restaurants downtown. They can bring food to the, takeout food and things like that, particularly during this limited capacity thing.
Right.
It would not be that. I don't think it'd be that difficult to do. And as Mike points out, there's plenty of parking. Even if they draw circles, we have the white chalk stuff. So draw some circles down there in terms of where they can be, just like Central Park.
I have two thoughts on this. It's obviously it's within the Board of Selectmen's purview, not mine. But I think that
Are you still on the board? Are you not on the board anymore?
No.
Did you resign?
No, I did resign.
She
That's
became
right.
a state senator.
I knew that. I thought you'd have a dual role.
Exactly. And so I didn't run again. But my point is this kind of innovative thinking is exactly what we need, because as we come out of the COVID economy, we're going to be looking at things differently, and we're going to be jump starting with new ideas. That type of innovative idea, I think, is going to put a spotlight on things that Michael has been talking about. For example, why don't we look at having a one-way Main Street or other street? Why don't we look at having shuttles? All of these things are going to take the conversation between the administration.
Susan, we don't have time for the conversation. We've got to start doing things now.
That's the Board of Selectmen.
Phase 3 is going to come on top of us, and this summer is gone. And you know what? I know you're a new politician and all, but I'm frankly sick and tired of waiting for stuff. People have got to start making the moves now. And they got to say, okay, we need to be able to do things. We can't even plan. They decided to open the restaurants today. Clark, did you try and get food in today? How difficult it was to get your suppliers in? We had no idea what they're going to do. We have got to have things done ahead of time. I'm not yelling at you. I am angry. I'm fed up with, frankly, the politics of all this. Things need to be done and stop dragging our feet. The numbers are good.
I think, though, to be fair, a lot of that direction is coming from the state. It's coming from the
Well, I know.
governor's office.
And I'm
And
not
through
young
ex-
Susan, by the way.
No, I know. But, don't forget, it was through his executive order that the select board was able to streamline a lot of the approval process, particular for outdoor seating, to expand on top of what they have. So I think, at the local level, people are working hard and trying to come together. And I know you're right. This action is important, but we're still not even to that part two of this, part B of phase two. And you're right. It's going to come fast and furious. But, I think the most important thing is for people to follow the rules and do what the state is asking, because the other side of this whole thing is the health issue. I mean, if the numbers spike back up and we get Gary next Monday saying, oh, I don't know, numbers are going the other way, that could, if we takes us back to a phase one, that would be devastating.
These businesses are not going to, I'm not worried about myself because I'm fine. These businesses are not going to survive unless action is taken soon. The season's going to be over. I mean, Clark is facing it, I'm facing it. Do we take reservations going forward? How many can we take? What do we do in the restaurants in terms of they want to take reservations? There's so many rules right now that that are going to hinder a business. And again, not mine, because I'm fine. The smaller businesses are going to have a problem, and I feel such empathy for them in terms of the ability to do things fast. I realize that the numbers are getting better, and we're worried about them going surging again. But at some point, we got to pull the plug and say, let it rip. It's people like you who have the problem. I'm a 75-year-old person who shouldn't be going out to dinner because I'm afraid of getting something. And I'm getting off the track here. I'm getting angry.
So, Clark, Bill just said, thank you for that, Bill. And, Bill had talked about, he thinks he's going to be like doing 30% of what he did last year. Now, granted, the functions aren't going to be there. But I know you've been very innovative in making that outdoor seating area and all. And obviously, it's hard to compare this year from last year. But do you feel confident that you'll be able to, at least make a go of it? That, I can tell you, again, to reiterate, based on the calls and the emails we're getting, people are planning on coming down. We're getting, do you feel confident that you'll have a season?
I do. I do feel as though that we're going to have the business, other than the group business, other than the wedding business. Restaurants and hotels gainly make money when they have weddings and groups. But I think we have to think outside the box. I think we have to schedule outside the box in order to make it fall to the bottom. I understand where Bill is coming from. We do have to act with a sense of urgency in order to get this thing moving. But at the same time, we're going to have a season. I don't even think so. I know we're going to have a season, and we just have to manage it differently. I think one of the problems that we're going to have is the ability to change quickly. Bill is capable of changing very quickly, thus as I am. But many of the other individuals won't think ahead to the degree is that if I'm not going to have this business, what do I make to move in this month that won't hurt me too much down the road?
Sure.
And I think we're going to have a season. I mean, I just walked outside to take a call, and now I got 20 people waiting in the line, Bill, for drinks. And,
we know where we're going, I guess, after we tape this show, right?
Right. Yeah, come on up.
So, Sue, again, going back to like what we were saying with the governor. So, I mean, basically, this phase two is for 3 weeks, let's say 3 or 4 weeks, and there's no definitive. But, in 3 weeks, we could be at the second part, which puts us just before the 4th of July. And then we could be into phase 3 right through July. So there could be a strong, really strong July. And then by August, possibly, we could be in that phase 4, which is pretty much back to normal, normal as normal is going to be. But, at that point, you're going to be able to go back to having functions, I think, with regulations and limitations. But with any luck, as long, back to Gary, just keep pointing to him because, what he underscores every week is the importance of the numbers continuing to go down. And, if there's a spike, that's going to ruin it. But if people remain responsible and follow the rules, I mean, we could be on the other side of this before the end of the summer.
And by the way, not to defend rules that have, I think it's incredibly difficult to codify human behavior at the level that you really want to kind of, to control the spread. I mean, should there be 6 people at a table? Should be 4 people? Well, if they're all from the same family, there could be, and they're living in the same house, it could be 20 at the table. It wouldn't make a difference. But how are you going to verify that, right? So I think it's very hard. And I think the other thing that's hard is if a while back, we had done pile more testing and a pile more analysis, we'd have a better handle on what's going to happen next. This is very hard to forecast.
Yeah.
And if it wasn't hard to forecast, then you could make a forecast and then we could plan our businesses around it. But it is hard. And one of the reasons is that we did not, nationally figure out how we were going to do enough testing and early on. And if we had, we would know a whole lot more about what's going to happen next. We don't. And so, I don't know what else to do except, let the data speak to you and react to it. But boy, I have to say, having run some tech businesses, that makes it awful hard to run a business. So I sure get it. It would be, when you can't make a forecast,
right,
it's really hard to run a business.
Gary, let me give you an example of something. I just, invested, I'm sure, Clark, you've done it, invested in a tent at Clancy's. And it's
Right.
a very expensive tent for the remainder of the season. Now, I'm able to do that because of my ability to do it. And so I have now, my uncertainty is sort of, if they continue with outdoor seating or whatever, I've got seating. The small guy or the guy downtown or whatever doesn't have that ability. So the uncertainty there is going to kill them. It's just going to croak their business. And I need those other people supporting the whole area in terms of what we do, as Clark points out. Those are the people, they want to be able to have a full experience here on Cape Cod. I just want to get rid of some of this uncertainty, and it's unfair to them because they can't make the investments that they have to make without knowing what's going on. And I guess that's my fear. Enough said.
And I hear you, and the governor is hearing there. If you look at the information and guidelines that have come out, they have been adjusted. The governor has been flexible as the information has come in, as Gary stated. One of the things I'm buoyed about is this ability for the hospital to test. That, as Gary just stated, that has been an albatross on the neck of all the businesses up until now, the fact that there was no information. So Cape Cod Hospital coming out with that flexibility, I think, is huge. I think the fact that the governor is not etched in stone as the task force learns about particular circumstances, that information goes right up and it gets straight, right on the table of the decision makers, and it's put through the public health analysis and it comes out as a change or not. These are, and yes, it's very difficult to order supplies and plan. And I think that, I think it's going to get better with the testing ability. But the other thing I'll say is if we can be vigilant about the rules and really publicize that, I think that's going to not only increase consumer confidence, but I think that's going to have the effect that Gary started with, which is after Memorial Day, it looks like we may not be seeing a spike. That's what everyone was worried about. And so that, I think that's a good thing, and we should continue to work on that.
Yeah, as the numbers go, and you're right. I think a lot of this is, entrepreneurs, people who own their own business, are creative by nature anyway. They're making the changes, and we're learning as we go along. We're no different in the Chamber of Commerce business. Whether I'm having conversations with Wendy at the Cape Cod Chamber or my counterparts at the other local chambers, we're in the same situation. Our revenue is way, way off. We can't be asking members for dues money right now if they're not having any business. But we still have expenses we have to pay. And again, as I've mentioned before, we never had the benefit of the PPP, So, obviously you're right. Numbers are going to be lower, and I wish there was faster action, but the reality is we have to work within the rules that are set down. And I am very hopeful that things are going to work out, and that, the numbers will continue to stay down. People will pay attention. And I think people want to get out and start supporting more. And, I'm hopeful that at the end of all this, I'll tell you the innovation that comes out of it. I'll tell you a very, very simple story. I had to go to the registry of motor vehicles last week. So, it's by appointment only. So I went up to Plymouth to go to the registry of motor vehicles. And I got there, it was a 9:40 appointment. I got there early, and it was a police officer outside. And she said, "Do you have an appointment, sir?" And I said, "I do." At 9:40, she said, "Well, please remain in your car and I'll give you a call. We'll call you when it's time." So every 5 minutes, she had a bullhorn, and she'd say, "Okay, anybody with a 9:10 appointment, please come up." So 5 people would get up, and then one by one, they'd let them in. So when it was my turn, I went in, I went up, I got in line, then they took me in into the little vestibule area. There was another police officer there, and she asked me, "Do you have a temperature? Have you felt sick? Have you left and come back from Massachusetts, etc.?" Of which, I was clear. And then I was to move forward, and they had it all lined up 6 feet apart. I went in, I did my business. I was out of there in 15 minutes. And when's the last time you got out of the registry in 15 minutes? I said, you should do this appointment only thing all the time. I mean, it was amazing. I can't. So it's there, again, the point I'm trying to make is out of this lemons, right? There's lemonades being made, and people are looking at different types of procedures and ways of conducting business. And in the end, who knows? It could be a positive experience.
Those are the ones that are going to survive. I'm also in the retail business. So explain to me now how this small retailer is going to make, when they're not allowed in the shops. There's a certain 2 people or 1 person at a time or something of that nature. You got Walmart's wide open and TJ, or not TJ Maxx, but what's the other one? Target are wide open, and because of the way the rules are set. So the little guy on Main Street, that's what I'm looking for. I'm talking about the little guy on Main Street. You're a major person. That person is strung with so many rules that make it, to let them survive. You got to remember, the inventory they're sitting on is so stale right now. They had their spring inventory, right? That's now gone. They're on the summer. So they're trying to get rid of that to get their summer inventory in. And they're not giving them the opportunity to do that. And I don't, Gary, I know you know the numbers as well as anyone else, but somewhere in between all this, there's a way of doing this that they're being hindered. I believe myself, and I don't know the answer. I'm not against the governor. I'm not against what he's doing safety-wise. This is not political. It's just some common sense that's got to get thrown into this mix somehow to save these businesses. And
well, it's frustrating. You can sense your frustration, but of course, they're coming from a point of common sense that, if people continue to get sick and spread this around, then it's going to be doom and gloom, all over again. So you're right. I mean, you bring up a good point. It is challenging and it is hard.
And also to comment on this, if you were trying to codify what human behavior in the U.S., you might think different than you would think in other countries. And for instance, in Asian countries, even before this, wearing a mask was, kind of commonplace. Even in Japan, kind of commonplace. If you could, I think some of the laws, I don't know, I'm not in the room, but I'm sure some of the laws or rules that are written are assuming less than perfect compliance because of our culture.
I think I'm responding to what I'm hearing from our telecast and from phone calls of people who are very, very frustrated and wish they had some different sort of answers to. And it is frustration. There's no doubt about it.
I get it. I don't see how it is. And it's very difficult to operate a business when you can't forecast even 2 or 3 weeks out. Because I can't right now tell you 3 weeks from now we're going to phase 3. I can't, and I don't think the governor can either.
Right.
I mean, I can't. I hope so, but I can't.
Well, we're all hoping for that, right? As soon as possible. Are you seeing, Sue? Now with your counterparts in the state senate, different regions of the state. We're in this obviously this tourist environment here, and then the Berkshires and Cape Ann are probably dealing with the same thing. Really at a disadvantage, or is pretty much the whole state really pretty much in the same boat?
The whole state is really, in terms of small businesses, I think Bill's right. That's really who's hurting and who needs the most attention, and who hopefully will be able to support, and through online sales and anything that they could possibly creatively offer to survive. But at the same time, as you said, Michael, entrepreneurs are very adaptive. When you mentioned the registry example, I talked to the registrar last week. They're taking that feedback directly so that they can accommodate what sales that makes sense for direct point, to make things more efficient. There will be a lot of changes that will be positive eventually that come out of this. In terms of small business, though, our Main Street, the vibrancy, what brings folks there, those are the people, I agree with Bill, that need the most support right now. So that's why there was a unique Cape Cod task force that was created to take the feedback that's received from those businesses and bring it directly to the governor. So as we're just opening up now, I believe we can speed that along if we get good test numbers, and also bring specific situations and specific businesses and say, this is why 3 at a time doesn't work, or this is why, 10 feet doesn't work, or 6, whatever the particulars are, and suggest specific solutions.
So I have a question, Bill and the rest of the panel here. What are we doing to be able to encourage? And who are some of the small business people come to? You can always go out and get a loan. You can always go out and do things. But Bill, you are the ultimate individual here in the Cape as far as respecting your entrepreneurial skills and what you've accomplished here. But is there any small businesses, is there collaborative to help those individuals and guide those individuals? Bill understands forecasting. Many small businesses don't understand forecasting. Many other small businesses don't understand the factors of making the changes before it happens. And right now, I'm planning to make changes today for 3 weeks from now.
Sure.
And this is what we have to do in this business. And you have to be able to, and many of our individuals are good restaurants, good shops, but they don't have that business acumen to be able to survive in this kind of actual situation. And
Clark,
do we carry ourselves up to help them?
It's a great question. Michael can answer that. Mike, given the resources you have, a score, and all, you know those resources that are available. But we lost you, Mike.
Oh, how's that?
Go ahead.
I got muted somehow. There are a lot of good resources, and Cape Cod Score is one of them. And there's all sorts of groups and seminars that are coming out that are being offered through all the different chambers. And if you go to our website, you go to the Cape Cod Chamber website or the other local chamber websites, there's a lot of resources that are available to people out there. The SBA itself is providing resources for people to try to deal with all this. Now, again, the question becomes, people are trying to figure it out. Do they have time? Is it, it's a time of intense stress for a lot of people, but there are a lot of resources out there to help people. And, I know that the Massachusetts Office of Business Development, they have representatives dealing with the chambers and providing seminars for members. And these are things that people should take advantage of that can help. And I really do believe that, like Gary said, I think if the numbers stay where they are, I think there will be a quick move forward. I do. I think the whole goal is to get this economy opened as soon as and as safely possible. But again, the resources are there. Our doors are open, our chamber, the other chambers. If any businesses have any questions, we fielded tons of calls from small businesses already that we've referred to different people, many of our own members who have expertise. And we've had people with payroll issues or, health benefit issues, or what do I do in this case? And we have, attorneys in town that are employee, members of the chamber that are employment attorneys, and, they can answer questions about how best to take care. The number one question we're getting from a lot of people is, how do I take care of my employees during this time? What resources are available to me? I know Mike Galasso on the board over at the EDIC is working feverishly to try to put together a mini grant and a loan program. Again, 2 businesses that might have fallen through the cracks. So I feel like the whole community is coming together and really trying to support each other. Again, to your point, Bill, it's extremely frustrating to many, many of us. And it's just one step at a time going forward. But I think there's got to be a little bit of optimism, hopefully there. You got to, if you don't look at it as the glass is half full, I don't know. There's going to be some of that. Faith is going to be there.
But Clark, back to I don't know what you're looking for the season in terms of the amount that you're going to do compared to last year. And I guess the bank is funny. Cape Cod 5 is doing a regional seminar, a regional meeting thing virally, how do you go, virally or virtually, whatever you call it?
Virtually.
And and some of the questions are very interesting as to what we feel the summer's going to bring, what do we feel the fall is going to bring, and what we feel that next year is going to bring. And let me pose that question to you. You're talking about right now, okay? So what do you feel right now? What do you feel for the end of the year? And then what do you feel for next year? What would your comments be on that?
Next year is extremely positive, since most of the actual groups, 85% have already, inclusive of weddings, meetings, have already transferred over to next year.
That's good.
I can scale down my actual expectations for this year in order to meet the demands. But I think one of the things that makes this a vibrant community has been also when people come here and you go down to Main Street, that's important. And I think it's extremely important that they survive in order to make this an attractive community. Because if I get people this year, you go down to Main Street and then you hit August and September and half the places are closed because of the lack of, then that leaves a negative negative taste in their thoughts and mind. And how do we help those individuals who are members of the chamber, those individuals who are not members of the chamber? How do we manage our actual staffing to be able to be open-minded to the fact is that if the town survives, we survive. If the town doesn't survive in a positive nature, then none of us shine as much as we want to be able to stand tall and shine. And that's where I'm at. I will make adjustments. I will make adaptations. I will change on the quick. But at the same time, many of the other individuals, if they do not survive this, we will not survive. Not in the breath that we've survived for the past 10 years and during my time here. And not only from a staffing perspective, but also from an exposure perspective. If you come into Falmouth in September over the past 10 years, October, even November, the town is buzzing. And now as we approach this new avenue of what we're going through now, if you come in town and you find half the shops closed, that's not a positive.
Right.
That's not a positive. And want to make sure that not only do I am concerned about I live here, I work here, and I want to make sure that I do as much as possible to lend to that.
You know, I think Bill brought up a good point. You know, back to you, Bill, and your concern about the rules and the regulations, and you're absolutely right. You know, we've mentioned before, Falmouth is kind of in a unique position where, you know, our population is going to go from 32,000 people to 75,000 people in 2 weeks.
I think it's here already.
You're right, and I think it is, and certainly on the weekends. But you know, we have that built-in second homeowner population that's going to be here, and they're going to want to go out and support the restaurants and want to go out and support the retail. And you know, we're all doing our best job to tell that story and get people. But back to your point, Bill, which I agree with, is that if they're limited to how many people they can see, I mean, if you can't try clothes on, you know, how are you going to buy clothes? I mean, some people will and all, but you're right. Those do seem kind of oppressive. And the hope is that, you know, the data and the feedback, you know, both the data that Gary talks about and the feedback that Sue has spoken about will get back to those decision makers, and that those rules will be relaxed at least to the point which will give these people the opportunity. I have no doubt there's going to be enough people here to generate, you know, business. It's going to be what are we going to be allowed to do. I mean, to your situation, Bill. Now you've got the Flying Bridge in Falmouth, and then of course you got Clancy's out in Dennis, is it not?
Dennis, somewhere over the side, I am somewhere out.
Yeah, right there. Well, I just
Dennis.
Now, do you for Dennisport? Yeah, I always get confused from top to the bottom. But do you find that, you know, it's different? I mean, do you find that, you know, it's probably much? Is it more of a tourism group that's out there at Clancy's and at the Flying Bridge? Do you have a lot of your old favorites of people who are here all summer long that come in tried and true customers, or is it pretty much the same?
That's a good question. There seems to be more, from my perspective, Clancy's is a lot more homespun folks who are out there. It's almost like Cheers in a sense. Yeah, it does dramatically jump up in the summer for the summer visitors, but it is different. The Flying Bridge, though, is strange. We have a lot of folks who live in the area who go to the Flying Bridge.
Right.
Obviously, it's beautiful out. And if they're bringing guests into town, they go to the Flying Bridge. That's the first place they're going to go to. But it's also a lot of the locals just go there, and then, of course, again, the tourists come as well because it's, you know, it's on the harbor, et cetera. It has wonderful food, by the way. So, well,
As Gary will attest to, the onion rings that we never got.
The onion rings.
That's a different story.
Those, but otherwise it's fine.
Gary and I got left in the cold. We'll have to come again. But
It
yeah,
is
I mean, it's
down there.
you know what I've seen too, because you know, Dari and I have been trying to obviously support our chamber restaurants and doing takeout like we all have, and I've seen a lot of activity. I know it's not enough to make.
By the way,
I'm sorry.
we appreciate that.
Well, I know, and you know, people are doing that, and I think the community has come out and done the best they can to try to support. I think that's only going to increase and go. And, there was a lot of time, with all due respect, Bill, there was a lot of time and energy spoken about the restaurants. There's a lot of, but I agree with your point too about the retailers and the fact that, they're sitting on that inventory. And that's a really challenging position to be in, particularly the ones that have been closed all this time. Some of the businesses have been going along and doing their normal, regular business, and even better in some cases, like you point out, Walmart. Kind of a advantage over others. But hopefully, this thing will continue to move forward, and we'll be able to get to the next phases. People are going to be here, and then. It's going to be another Cape Cod summer, hopefully positive.
Yeah, on the positive side too is let's recognize that and I'll freely admit this, the numbers so far have been much better than my expectation, and I just hope that continues.
Right.
But one thing that I'll say is that we, to go kind of old school, in the days when the shops weren't open off season or very late, as a member of the accommodations group, for a dozen years, we worked and directly communicated with Main Street businesses. And I think the more that there can be a sharing of, well, this is open, more, just do, like the palm cards, the pamphlets, try out this business, try out this dress shop, that clothing shop. I think we have to get old school to just really keep the blood pumping on Main Street. I think that'll be one great thing that'll make Falmouth unique, because that's what we're good at.
Fantastic.
Isn't Falmouth nice?
Yeah. Falmouth cares. Did we lose Clark?
Falmouth cares. No, Troy's back. Clark's back too. Perfect timing. Here we are.
Clark, I have a question.
So Troy, back to you, I guess. Oh wait, Bill has a question for Clark.
I have a question. Clark, where'd you buy that shirt from? I gotta get one of those shirts like that. Your shirt.
One of the shops on Main Street called.
There you go. All right. Great shirt. I love it. I love it.
Well, I'm sure you all did a great job in my absence. I apologize. My day job took me away for a few minutes in responding to the constant needs of this pandemic. But I'm sure you had a very substantive and great conversation.
Talk about you.
I'm sure it was said during the discussion, Sue, but I obviously join my colleagues here and offer you warm congratulations, and we're very grateful to have you in the Senate representing the interest not only of Falmouth businesses, but of our citizens as well.
Thank you. Looking forward to serving on a different level.
So looks like we're nearing our closing. So as is our tradition here, we're just sharing the good news of the charitable side of Falmouth Cares. And we are nearing the end of our T-shirt sales because for a couple of reasons. One, because Bill and his team at the Flying Bridge have been generous enough to coordinate the mailing of all of our T-shirts for the last several weeks. And they're now getting ready to serve onion rings and fried clams to many hungry patrons. And so we'll be slowing down the T-shirt sales, but they are still for sale at the Clam Man on Boxwood Circle in Falmouth. And if anyone is interested, you can reach out directly to any of us or still at bteofalmouth.com. And if there are any straggler sales, I'm sure our team here will be happy to coordinate getting them to you and delivering them in person, as Bill has absorbed the cost of the postage, and we appreciate his generosity there. We have sold nearly all 1,000 of those T-shirts, other than the ones that were donated to the nursing staff at Falmouth Hospital. So that represents well over $10,000 that's been raised for belonging to each other and the Falmouth Service Center. So it's been a really positive and poignant, I think, aside to the work that we've done and will continue to do here on the show, spreading news and messages about the impact of COVID. But this pandemic has had a very positive impact in helping us create Falmouth Cares and really making a difference in our community.
Troy, do you want to mention the other donations that we've received too, or Michael?
Yeah, well, this week, it was wonderful. I, as a member of Falmouth Cares, I had the honor of being the recipient and accepting for the group by the Falmouth Fireworks Committee, a check for $1,000 that will be split evenly with the Falmouth Service Center and belonging to each other. And in addition, David Chapman of Chapman, Colin Gleason also made a nice donation to both those organizations. So thank you very much. You know, it's an amazing community.
And by the way, the track club made a donation as well of $500. I don't know if you guys even knew this, which they in our name, and they did it directly to belong to each other and in the service center because of Falmouth Cares. So just wonderful.
We're gonna come up with some more ideas as we go forward with this to continue getting the money to those folks. They need money badly.
You know, I want to thank all of you for your leadership. Everyone on this show, it just really, you know, puts it out there for the community. Thank you for that. Thank you, Clark, for just, you know, everything that you do for the community. And all of you, appreciate you getting the information out to everybody who's watching, as well as the benevolence that you all do, and because you don't make a big deal of it, you don't tout, you know, blow your own horn. So I'm blowing it right now for all of you. Thank you.
Thank you.
Thank you, Sue.
Well, we thank you. And you can this week call me the bookend host. I'm here for the beginning and the end, but that's the easiest part and it's the most fun part. So thank you very, very much to our guest this week, Senator Susan Moran and Clark Guinn from the Crest Beach Resort. We're really glad that you both shared your experience and your hope for a better tomorrow with us this week on the Falmouth Cares Business Roundtable. So we'll wrap things up now, but we will be back next week, and we will continue to do this on a weekly basis so long as there's value to our discussions to you, the folks for whom we do this. So everyone stay safe. Have a great week. For our panelists, Michael Kasperian, Gary Vacon, and Bill Zammer, I'm your host, Troy Clarkson. Stay safe and have a great week.
Thanks, guys.
The Falmouth bells were tolling, and our hearts sang on. Was it the spell of our town, or an April dawn? Who knows if we shall meet again? But when the morning chimes ring sweet again, I'll be seeing you in all the old familiar places that this heart of mine embraces all day through. In